My name is Kayla Ringer, and I'm originally from Wheeling, West Virginia, but I live in Shadyside, Ohio. I was diagnosed in, I want to say 2017 at Weirton Medical Center with pancreatitis. It affected my life pretty significantly. I wasn't able to do normal things that people would do. Most things seemed like a difficult task due to the pain, never knowing if you're going to get sick. You couldn't eat normal. I had a very restrictive diet. It was difficult to do normal everyday things. I had severe stomach pains, abdominal pains, a lot of vomiting. Eating became quite an obstacle. It seemed like anything would set it off, and then I would end up in the hospital for a week or so at a time. I have children, so it was difficult to figure out how to schedule around them and have pancreatitis too. I started researching after numerous doctors told me that it was idiopathic, or that they just didn't know enough about the pancreas to be able to help me any further. I refused to believe that there was no answer for why I was having pancreatitis. I've been a generally healthy person overall, so in my mind there had to be an explanation and there had to be a fix. So I did as much research as I could. I learned about different, options that I had that I didn't know that I had had before. And it was kind of just a matter of finding someone that would actually listen to me and take into consideration that this could be, a possible fix for me. And by the time I got to Dr. Tucker, he agreed that there was something that could be done. We just had to figure out what. So we got genetic testing done. And through the genetic testing, we determined that I had several genes that attributed to me having genetic pancreatitis, which we didn't previously know. Dr. Tucker worked real close with me, and when I had brought to their attention and asked them, am I a candidate for this TPIT surgery? Is this something that we could do here in-house instead of going, to another facility outside of the network? He decided that, he would talk to some people and see if this was something that we could do here, and luckily it was absolutely something that they could do here. So from there, he referred me to Dr. Boone, who looked at my case, and he agreed that removal of the pancreas was the only way to make me any better, to have any better quality of life than what I had had. I was the pilot patient for the program. So Dr. Boone and a few other surgeons performed a robotic surgery to remove my pancreas and my spleen, and much like an organ donation, sent it to another facility. And at this other facility, they were able to extract the islet cells, which produce your insulin, out of my pancreas. And then they brought them back down here to WVU, where they went back into the operating room and directly put those cells into my liver. My liver will begin to produce my insulin from those islet cells. So over a period of time, the goal is that the liver will produce all of your insulin on its own without having a pancreas. I'm now able to participate with my children in their activities and with their school. Going to work is no longer an obstacle. I can go and do my normal things every day. I don't have to worry about if I'm going to be sick, if I'm going to be in pain. It has tremendously improved my life.